Hello and welcome to Woman Vision TV. It's where women talk. I'm Nadia Giordana and my guest today, Dr. Susan Strauss, is here to talk about a sensitive subject, the LGBT community, lesbian, gay, bi, and trans, and some of the issues they face when seeking health care in this country. Let's go talk to Susan and hear what this is about. Susan, welcome.
Thanks a lot, Nadia.
I'm glad you could get here today.
I am too. It's a gorgeous drive, even though it's a bit of a jaunt.
Yeah, there is a distance between us.
There is.
Well, we're talking today, and thank you for coming on and talking about this subject. Is it LGBT are the initials?
Right, LGBT.
Okay, lesbian, gay, bi, and trans. And there are a couple of other letters for part of this, and you can explain how all that works. But what we're discussing today is the issues that many of the people in this community face in the healthcare realms, and when they're receiving healthcare, they're not getting the same respect, courtesy, treatment that some of the rest of the community are getting in healthcare, and I didn't know that until I had spoken with you before. So take it away, Sue, and tell us some things.
Well, first of all, I think it's important to take a look at what percentage of the population is lesbian, gay, bisexual, transgender. And supposedly we've got, for the transgender, it's not very many. It's 0.3% of the population, although that's a 2011 statistic. And I'm guessing that with the change in how we as a society, and not just here in the US, but around the world, are looking at gender, we will end up seeing some changes in that, with it increasing. We have about 3.5% of lesbian, gay, and bisexual of the population. And for patients, though, it's roughly 5 to 10% of patients are lesbian, bisexual, or gay. What we're finding out is that there's much more fluidity with gender. It's not so binary as we've always thought. You are either masculine or feminine, but that there is a continuum. And for example, in the Native American community, when people are transgender, they're called two-spirit, because they're both masculine and feminine. And they're viewed as being, they're lauded because they have the ability to experience and view life from both types of energies, the masculine and the feminine. So we're seeing that in indigenous societies around the world. In fact, some countries right now have actually identified a third gender. Nepal has, Australia has, and one other, and I can't think of it. And so we're just seeing more and more recognition that people are on this continuum. But what we're finding with the healthcare professionals, is that we as healthcare professionals, and I've got a nursing background, and then I've worked in other roles within healthcare.
Yeah, you've been in the field.
Yeah, right. We assume, just like we do in society, that all of our patients are heterosexual, that they're all straight.
Yeah, absolutely.
And we do that in general, and of course they aren't all straight.
Without even thinking about it.
And it works against the patient. We have found that if the patient then isn't sure whether they should disclose, I am a LGBT person or not, if they disclose it, they risk being treated in a discriminatory or abusive way. If they don't disclose it, then their provider could miss checking, assessing the patient for specific kinds of, diseases that are more prevalent in that community. Let me give you one example. Excuse me, I'm going to take a drink here. If you are a trans female, which means that you were assigned being a male at birth, and you now are a transgender female, if you went through any sex reassignment surgery, and you had been a male at birth, they, and if you would have had any surgery done on your genitals, that doesn't necessarily mean that your prostate gland would have been removed. So now as you are an adult and you're growing and your genitalia look just like a female's after the surgery, your physician may not know you have a prostate gland, and therefore not check for any blood markers to see if it's elevated for prostate cancer, unless you have ended up telling them that. Now we can see the same for the reverse. Now men do get breast cancer, they do, but if you are a trans male and you had been female and you'd had a bilateral mastectomy, that means that in all likelihood you still probably have a little bit of your breast tissue left. If you don't confirm that with your provider, then the provider isn't going to think along the lines of breast cancer nearly as much as if you were a female with regular breasts. So it can work against you that way.
And here's a thought coming from a person who knows nearly nothing about this, because it really hasn't touched anyone in my family yet, but you know, who knows? So I'm learning, like a lot of other people are, is it necessarily, if you're a medical doctor, would you necessarily always know? Let's say this trans patient comes into the office, maybe has switched healthcare providers, moved across country. I remember we were talking with someone else a few days ago, and she was talking about, don't those medical records follow you? Well, not necessarily. Would a doctor then necessarily know that this person is trans? So is that good that they would not necessarily know?
Well, first of all, you know, up until just a few years ago, we didn't have an electronic medical record. It was all paperwork. We called it the chart. And even now, about 97% of hospitals and healthcare institutions in the U.S. are an electronic medical record, but not all of them are. And you know, unless it's a medical record that has, and you've continued in the same healthcare plan the whole time, they're not going to know. So you would have to disclose. Now, first of all, you would have to, if you were lesbian, gay, or bisexual, and then for the transgender, some will say we can tell, but others you definitely cannot tell if they're trans or not. And so your healthcare provider would not know unless you disclose that information. There are some others too. There's one called Q, which stands for two different.
That's new to me.
Yep, it's LGBTQ, and Q can stand for questioning or queer. Questioning means that you're questioning, am I gay? Am I lesbian?
Who am I?
Am I masculine? Am I what am I? And then there's the word queer. Now queer, years and years ago, used to mean, it was a derogatory term that was used. Yep, and
so
I do
I'm surprised.
But now it's been taken on by the LGBT community as a socio-political label. And so they will use that label. It would not be appropriate for a healthcare provider to use that label, or even for us as straight folks to use that label. There's also an I, and that stands for intersex.
That's new to me too.
Well,
what is that?
Well, intersex is actually not new. The term is a little bit newer. When I was practicing as a nurse, we used to call it a hermaphrodite, or a pseudo-hermaphrodite, where the genitalia at the time of birth were ambiguous. You couldn't determine whether you were male or female, and it was determined by either examining the internal, you know, did you have ovaries and a uterus, or did you have a prostate, and etc. And then you were usually treated, or if you didn't know then, maybe you had both internally as well, they would very often do what we called a buccal smear and take cheek cells and look at your chromosomes there to determine what you were. But now sometimes we're finding out that people are intersex at about the time of puberty. So when the hormones surge in, there can be some ambiguity.
Changes.
So there is that. And Facebook, for example, has come up with 50 different terms for various genders and sexual orientations and gender identities, because we also talk about gender expression, and that's how we express our gender. But then there's gender identity, which is, do you identify as a male or female? I'll give you an example. I work as an expert witness for lawsuits, and one of the cases I worked on involved a 17-year-old female. She identified as a female. She also was a lesbian, but her gender identity was female. Lesbian was her sexual orientation, but her gender expression was very ambiguous. So by looking at her, you couldn't really tell if she was male or female.
Tricky to follow.
Yes, it is. And so she was harassed unmercifully in the school. But we will see the same things with adults as well. Some of us express our gender much more in terms of you and I as females with maybe ruffles and lace and lipstick. Others would never be caught dead in ruffles and lace and lipstick, but they certainly still express themselves as female, but just different. So, and for those of us that were born with a sex assignment at birth, you and I, for example, we were assigned by looking at our genitalia as female, and our gender identity is female. We now are referred to as cisgender. CIS gender.
Okay.
So there's just a number of terms that are referring to the fluidity, which makes it a challenge then for health professionals as well, especially when they assume this heterosexuality.
Do health professionals get training about this early on, or is that something that's just coming on now, or has it even happened?
I suppose it would depend on what school you're attending, whether you are a physical therapist, an MD, a registered nurse, or whatever. They should be getting trained in it.
Yeah.
And I would guess that most are not, other than maybe a bare minimum. What we're finding out is the research is showing, for example, that nurses have really no clue how to treat a transgender patient who's going through sex reassignment surgery. One of the cases to show you how abusive that folks can be treated happened right here in Minneapolis at the Fairview system, and this was a young transgender male, and he had been female assigned at birth. He had not had sex reassignment surgery, so his genitalia were female, and he developed a severe infection of his female genitalia even though he was a transgender male. He went into the emergency room and had to wait much. Well, first of all, when he went to check in, they identified him. They had put female on his chart, and he said, "No, I'm a male." And they said, "But your driver's license says you're female, and we have you as female." And he said, "No, I'm a transgender. I'm male." Oh, well, we have to include female on here. And so immediately he was already being discriminated against.
It's already a problem.
Yeah. And that's just with somebody at the front desk who had no clue as to what she should do. So then she goes over and talks to a colleague, and they're kind of whispering. And of course he knew that it was about him. He had to wait much longer than other patients to get seen. Now, granted, you have to triage patients, and who knows why others were in, but he waited much longer. Then he gets into his little curtained area.
He was very sick at the time.
Yeah, he was sick. He had to wait again. Finally, an ER doc comes in, a male doc, and goes to do a pelvic exam on him, and sees, of course, that it's female genitalia and that he's got this severe infection, and starts being verbally abusive to him. "What in the world have you been doing? What have you been sticking up here anyway? Objects other than whatever. Who are you having sex with?" He would never have said that to a woman. "What have you been sticking up there, and who have you been having sex with?" He was rude to him. He was abusive. The patient was saying, "Stop, stop, you're hurting me." What adds to it is there was a female OBGYN physician that was also brought into the ER. She didn't say a thing to stop this ER doc. There was also a nursing assistant. She didn't say anything. Of course, when you look at the hierarchy, she probably wouldn't, but she still had a responsibility to. And the patient kept saying, "You're hurting me, stop." Finally, the mother who was in there said, "Don't you hear my son? He's telling you to stop." And so the doc finally stopped, walked out. They had to admit him to the hospital. The infection was that severe. He gets up to the unit, and one of the nurses comes in and says, I just don't even know how to take care of people like you. I mean, what a thing to say. Then, now this is all what's alleged in the complaint. So we don't know the other side, but the judge accepted this complaint. Then there was an infection control doc that came up and examined his genitalia to find out what bacteria were involved, etc. Of course, had on gloves. This blows my mind. Instead of removing his gloves to check on the patient's eyes, he kept the gloves on and went up to his eyes and transmitted the infection from his genitals to his eyes.
Oh my gosh.
And this is somebody who specializes in infectious control.
Yeah, and is a doctor.
And is a physician.
Yeah.
So they are suing. This is the very first case.
It's like lack of respect and consideration.
Oh, big time. And it's discrimination, and it's illegal. In this case, they're suing under the Affordable Care Act. So the Affordable Care Act disavows any kind of discrimination. Now there's a second case also at Fairview, and in this case, this was a trans woman. She had been male. She wanted to be treated for chemical dependency, and in this case, she wanted to get day treatment. So when she went in to get admitted, and they found out that she was trans female and of course wanted to be in with the women, they said, oh, we can't do that. They'll know that you were male. They won't want you in there, so they wouldn't admit her.
And I'm thinking about that. I'm not sure why that would be such a big problem. If I were in a group or whatever, it wouldn't make a huge difference to me in that situation, but obviously at least the healthcare professionals felt that it would be, or maybe they were using that as an excuse. I don't know.
I don't know either, but that has been brought forward. We don't have the results on that yet. But let me tell you a little bit about what a transgender is. Sometimes people use the word transsexual, but it's kind of an outdated term.
Are they the
anymore.
same thing or just different terms?
Well, they're different terms. Some people say that you're a transsexual if you are actually seeking hormonal treatment or surgery, but it's really pretty much an outdated term right now, and transgender is what's being used. But basically, if you were to close your eyes and be who you are, Nadia, woman, you've experienced life as a woman, but if you were to look down at your body and see your body as a man, that's what transgender is. So their sex is assigned by a physician by looking at the genitalia at birth, but it's where your gender, which is your psychological, your sociological, your anthropological, it's how you experience the world, is not what your genitalia say, it's the other.
It's like the brain and the body don't match up.
You got it, exactly.
Okay.
And you're not a freak. It's something that happened in utero. We know that children are disclosing that they don't know the terms, but they're saying that they're the opposite. And parents, of course, are saying, well, what do we do here? We're fortunate in Minnesota that we've got the University of Minnesota, which does a lot of work with that, transgender. But that's basically what it is. So when we say that there's only 0.3%, my guess is it's probably going to be more than that, particularly when we look at the fact that some folks are saying, I'm not transgender from that perspective, but you know what? I'm both masculine and feminine. I don't need any surgery, but I'm not one or the other.
So that's the identify part?
It's just
different.
Well, it's new. We're all sort of learning about it. And it's also, I'm both, or I'm neither. Or today you can refer to me by the gender pronoun he, but maybe tomorrow I want to be known as she. So it's complex, it's confusing, and I think everybody's trying to learn about it. We're seeing more and more of this happening with children. I'm doing some research now, and I've been into 4 different schools, and even a small kind of a rural school, and all of them have transgender children.
Really?
Students, everyone out of the 4, So we're finding more and more about that. But let me just fill you in a little bit. Transgender patients and patients that are gender non-conforming experience 21% harsher and abusive treatment and language. 8% are physically roughed up. Can you imagine?
I
This is
can't
by health
imagine that.
professionals.
Yeah.
And 20% are blamed.
I
for
can
being this.
imagine that being done.
They experience 2 to 3 times, now this is transgender folks, 2 to 3 times more barriers and discrimination in their health care than do lesbian, bisexual. You know, I talked about what the transgender folks experience, which is worse than what the gay, lesbian, bisexual. But all of them experience discrimination in their treatment by health professionals. I think the other piece is that some healthcare professionals actually refused to touch an LGBT patient.
Like it would be catching.
Well, one of those that they didn't want to touch are those that were living with HIV.
And that's been around long enough. People should know better.
They should know better. They absolutely should. Now, when we looked as well, 27% of transgender patients were absolutely refused health care that they needed. About 8% for LGB, and about 19% for those living with HIV. I think the other thing that's important to look at is just in general, LGBT people experience greater health disparities than those that aren't. They are more prone to certain kinds of cancers. They tend to have more trouble with mental health, which makes sense the way society treats them. Higher rates of sexually transmitted diseases, including HIV. Higher rates of smoking, alcohol, and substance abuse, and lower overall health status. So, and sometimes they struggle with getting coverage for health insurance.
Oh, yes, of course, that might happen.
The other thing we need to remember is that older folks are also LGBT.
That's another portion of this.
It really is. And so if they are in a long-term care or assisted living.
What happens in nursing homes?
That's right.
Yeah.
So, or even in hospitals or in clinics.
Yeah.
And insurance carriers need to be aware of this. So very often, it's only been, recently that as a society, we're much more accepting of LGBT.
Yeah.
So many of the older patients have never experienced that acceptance. So when they're admitted, they're even going to be less likely to disclose what their sexual orientation is. So one of the things that I think we need to tell people is ask them if they say any of these things to each other. I'm going to read this. Oh, this just isn't what I was brought up to accept. So I hear this from healthcare professionals. Are people going to start thinking that I'm gay just because they're taking care of someone? Or if they have an LGBT colleague and they are friends with that person. So we have to look at
I've seen
health
people act like that.
Yes.
Yeah.
Will being okay with gay issues lead to conflict with other people? Will I be in conflict with them? Oh, this is much too political for me. I don't want to deal with it. How will this influence my relationship with other people that I work with? If I'm taking care of an LGBT patient or I'm friends with an LGBT colleague. I just don't know enough, and I don't want to say the wrong thing to give incorrect information. So it's just easier for me to keep my mouth shut.
Yeah.
Now imagine if that's what you're feeling and you're coming in to take care of an LGBT patient, that's going to come through, and they will recognize that. I don't want to be the healthcare provider with the reputation for having a gay practice. So we're finding that there's all sorts of issues, and what we're really trying to encourage, and you had asked about training before, is that all healthcare institutions, whether it's public health, home health care, clinics, that they need to be doing training to teach the health professionals about the LGBT community, how to treat them, what the risks are in dealing with LGBT patients by not treating them fairly, to talk about the Affordable Care Act, and there are a number of other laws as well that protect the LGBT patient. The one that I told you about with the ER and the substance abuse were the very first two in the country under the Affordable Care Act. And I think we're going to start seeing more and more of those. So we've got a ways to go. And healthcare institutions need to even be aware of how are they reaching out to the community. Do they have educational programs that they're offering to the community? Or are they offering programs specifically for their LGBT community? So when they put up posters, do they show posters of a same-sex couple, or a couple that is gender non-conforming, or a trans patient? Even when they start asking questions, when somebody is admitted to the hospital, we need to watch what kinds of questions we're asking. Are we merely, and let me try to find this, I'm not going to be able to that quickly, are we merely having somebody come in and they check male, female?
Right.
We need to offer some other
Which is all I've
examples.
ever seen.
Me too. But we need to offer other examples, whether it's just other, or whether it's transgender male, transgender female. So we need to take a look at the different forms that we use when we are admitting patients, and what kinds of questions we're asking when we do their history and physical as a healthcare provider in a clinic, for example, but also once we get into the hospital setting as well.
Well, even other is enough to flag
Yes.
if they read that. A lot of times that just goes into the chart, and it's not necessarily, maybe the first time you see a doctor might quickly peruse it, but that's not something he's going to look at that closely, so it helps a little bit.
Well, and I think it would have to be accompanied by training.
Yes,
So you would
yes.
tell everybody in the hospital, for example, we are changing our admission form. This is what it is. You need to be aware of it and pay attention to how that's going to influence how you take care of that patient. And the physician likewise will have to inform all of his or her staff in the clinic, we're changing this,
Yeah.
and see what happens.
It's a huge subject. I
Oh.
didn't realize how big it was, and this is just for healthcare. There are other pockets of issues that this community faces that someone like you and I maybe wouldn't.
You're right.
Yeah, so there's a lot to learn.
Well, what we've been hearing, of course, recently is the use of bathrooms.
Oh, yes.
And
yes.
so that's been the use of bathrooms in the workplace and in schools. And transgender people, there's a lot about our LGBT folks protected in general from discrimination in the workplace. Transgender people are. LGBT, the EEOC says they are, the Equal Employment Opportunity Commission. Here in Minnesota they are for sure. But we have some courts that say they are and some that say they aren't. But right now, people need to be able to use the bathroom in which they identify their gender.
On that note, I have to say thank you for
Thank you.
coming on. We'll have to do
appreciate it.
this again.
Yeah, it's
And
interesting, isn't
Take
it?
it on again, yes. All
We all
right.
have a lot to learn.
Thanks a lot.
Thank you.